Go.
Welcome to episode 6 of the Skills Lab. I'm back here with my daughter. My wife is on video again. So the question this week, or the assignment this week, was to come up with a brief back examination that covers all of your bases. So from my perspective, the most important thing to realize is what are the things that you must catch when you are examining the back, and what are the things that you should do, and what are the things that maybe don't add much value to your examination but make the patient feel heard and properly examined. First thing I like to do is just observe how they look while they're sitting there. And when they are sitting there and looking comfortable, they should be comfortable when you're doing everything. If they look like they're in pain, they should look like they're in pain when they're doing everything. So the first thing I would have them do is please stand up. And I just want you to walk back and forth across the room. And really what I'm looking for is if they have any kind of posture while they're moving that might be associated with a condition. So if she was all stooped over, that would be consistent with a lumbar stenosis. If she was all shifted to the side, that would be consistent with a herniated disc. So you just want to see, it's like, are they consistent? Next thing I'd have her do is walk across the room on your tiptoes. So we're testing her S1 myotome. It's much easier to test it against her body weight than to try to have her push against my hands. Then walk on your heels. Here we're looking at the L5 myotome. Same thing, her body weight's going to be much more effective at uncovering any kind of weakness. If you don't mind having a seat again, please. So now I'm going to stand in front of her, and because pain from the hip joint can often be located in the same place where the lumbar nerves might be radiating pain, I always want to do a little internal rotation over pressure. And what this does is compress the hip joint, so if there's any related hip pathology, we'll be able to address that. Always test on both sides. Then I'm going to extend her leg. In effect, this is a seated straight leg raise test, which should correlate to a straight leg test when she's supine. And then I do a lot of my neurologic testing. 90% of nerve-related injuries in the spine are going to be localized to L4, L5, and S1. So all of my testing focuses on those nerves. So I do a patellar reflex on both sides. That was the Achilles. I'm just kidding. Now we'll do a patellar reflex on both sides. Good. Now I want to test sensation. I really don't know what these cotton tip applicators are really useful for in the clinic. Maybe everting eyelids, but I use them for testing sensation. And I like to do a screening of the entire circumference of the leg, so I get all of those dermatomes. And the way you do that is you just lightly touch. Does that feel the same all the way around? Mm-hmm. Same thing over here. So I'm getting S1, S2, L4, L5, all around there. That feel the same all the way around? Mm-hmm. The other thing you can do is break it so you have something to add a little noxious stimuli because it's a little short and sharp. And then ask, does this feel just as pokey? Mm-hmm. Same thing on the other side, just as pokey in all these locations.
Yeah.
So again, I've effectively looked at L4 through S1. I'm going to have you go ahead and lie down. And then we do a straight leg raise on both sides. If there was any other palpation that you wanted to do, you could do it now. I'll have her sit back up. This is where I palpate. So there's really not good evidence that palpating the back is going to offer anything that's going to change your treatment plan. However, if you do not touch your patient, they're going to wonder why. They'll think, how do you even know what's going on with my back if you never touched my back? So just palpate it. You might hear them say, oh yeah, it hurts there, it hurts there, it hurts there, and that's great. They'll feel heard. You might get some information. Occasionally a compression fracture will show up just by tenderness over that spine. When we did this earlier without the explanation, it took me just over 2.5 minutes to do that entire test. A little bit longer as I explain it, but you can see you can have an adequate examination easily under 5 minutes. So give it a try, let me know what you think. Don't forget to like and subscribe.